Hi everyone, and welcome to this Tutor to You Health and Social Care lunchtime live stream. My name is Liz and we are going to be doing Unit 2 today. We're looking at accountability, inspection and regulation, which is quite a tricky topic and one that students don't always enjoy. Hopefully I can help you through this tricky topic. So if you would like to join in, please do type your answers into the chat. That would be great. It makes it a lot more fun. Okay, so we'll go to our first activity. So I want you to give me 2 organisations that regulate and inspect health and social care services. So there are 2 that I'm thinking of. Are you thinking of the same ones? Hopefully you are. I will give you a 30-second musical timer so you can type your answers into the chat, please. Okay, so I can see Daniela has given us an answer. She has said NMC and NICE. So the NMC is the Nursing and Midwifery Council and NICE is the National Institute of Care Excellence. So those are organisations in health and social care, Daniela, but they're not responsible for regulating and inspecting services. There's actually 2 other organisations I'm thinking of. While I wait for some more answers to come through, I will reveal them. So we have the Care Quality Commission, known as the CQC. So they're responsible for monitoring, inspecting and regulating all healthcare and adult social care. And then we have Ofsted, whose responsibility is children's social care. Gabriella has said the GMC. So Gabriella, GMC, similar to the NMC, so General Medical Council, Nursing and Midwifery Council, they don't inspect and regulate services, but they do regulate professionals. So in the case of the NMC, that is nurses and midwives and nursing associates, and the GMC, that is doctors. Okay, so we need to read our questions really carefully, particularly in our exam. If it's talking about services, make sure you say Care Quality Commission and Ofsted. If it's talking about professionals that work in those services, depending on who they are, that could be the NMC, the GMC, the HCPC. Okay, really make sure that you're clear on the difference. Let's move on to our next activity. Okay, so I'm going to give you a red herring activity. So there'll be 4 statements or 4 items on the screen, and one is the odd one out, and I want to know why. So we have A, Nursing and Midwifery Council, B, London Borough of Greenwich Council, C, General Medical Council, and D, Health and Care Professions Council. So based on what I've just said about the NMC and the GMC, which of those on the screen do you think is the odd one out, and why is it the odd one out? I'll just give you a moment to think. So we've got A, NMC, B, London Borough of Greenwich Council, C, General Medical Council, and D, Health and Care Professions Council, so HCPC. So Gabriella's saying B is the odd one out. I agree, Gabriella. Georgia is saying B as well. Brilliant, thank you. Why is it the odd one out? So what do those other 3 things have in common? So NMC, GMC and HCPC, what do they all do? What do we think? Well done, Daniela. Zyphalon is asking for which exam? This is BTEC National Health and Social Care Unit 2, Working in Health and Social Care. Okay, Gabriella says B is the odd one out because it doesn't relate to health and social care. Yep, there is a more specific reason though, something that those 3 other organisations all have in common. I will reveal. Okay, so the other 3 are regulators of health and social care professionals. So nurses and midwives are regulated by the Nursing and Midwifery Council, doctors by the General Medical Council, and then professionals like occupational therapists, which is on your specification, are regulated by the Health and Care Professions Council. Don't worry if you're a little bit lost or you need to go over this again. You can watch this on replay on YouTube, and you can also download the PowerPoint, which I'll upload in the next hour or so to the Tutor2You website, and you can go through it again. Okay, so our next red herring, which of the following 4 items is the odd one out and why? So we have A, set codes of conduct or codes of practice, B, register professionals, C, find new recruits, D, validate degrees and training programs. Which one do we think is the odd one out here? Okay, Georgia straight in saying C, find new recruits. Gabriella agrees. So why is it the odd one out? What do we think? Well done, Daniela saying C as well. So what do A, B and D all have in common? I will reveal for you. So A, B and D are all key roles of professional regulators. So the NMC, the GMC and the HCPC, they set codes of conduct and codes of practice for nurses, midwives, doctors, occupational therapists. They hold a register of those professionals, and they also validate degrees and training programs. So to become a midwife, for example, a registered midwife on the professional register, you have to go to a university where the degree program is validated by the NMC. You then join the register and you have to follow the codes of conduct and codes of practice that the NMC set for you to follow. Okay, another one now, which is the odd one out here. We've got A, investigate fitness to practice, B, provide information to the public about expected standards, C, enforce revalidation procedures, D, write workplace safeguarding policies. Which is the odd one out here? And if you can, why? What do we think? Which one doesn't go with the others? Okay, in this case, the odd one out is D. Again, these are key roles of professional regulators. So they can investigate fitness to practice. If a complaint is made about a midwife on the register, the Nursing and Midwifery Council can investigate whether or not that midwife is fit enough to continue practicing. And we don't mean fit as in, aerobically or cardiovascularly fit enough. We mean, do they meet the standards and the expected performance of a midwife? Same with doctors. If a complaint is made about a doctor, we can investigate them and see if we are deeming them fit to practice, so fit to carry on being a doctor. The NMC, the GMC and the HCPC also provide information to the public about standards. So you can go to the NMC website, for example, and have a look and read the standards expected of nurses and midwives. Revalidation is something that nurses and midwives have to do every 3 years, and it's to prove that they are still fit to practice, that they still have the right skills, qualification, training, good character to carry on practicing, and doctors do it every 5 years. But what professional regulators do not do is get involved in writing any workplace policies. So they're not involved in the day-to-day running of health and social care services. What they do is they regulate the professionals that work in them, monitor their work, make sure that they are fit and proper persons to be healthcare professionals. Okay, in this next activity, I'm going to read out 5 clues. Hopefully the clues will get easier as we move through them. And what I want you to do is, after I've revealed each clue, if you think you know the answer, have a go at answering. Okay, let's have a look. So our first clue, this applies to those that work in health and social care. That could be anything, so I'll give you another clue. Established by professional regulators and bodies. Okay, so we're looking for something that applies to people working in health and social care, that is established or written by people like the NMC or professional bodies such as what can we think of? Royal College of Midwives, for example, or the Royal College of Nurses. Next clue, it's a set of expectations and standards for care and treatment to be given. Okay, this is making it clearer. So a set of expectations and standards. It's established by professional bodies. It applies to people that work in health and social care. It contributes to making care safe, effective and compassionate. I'm going to give you one more clue. And it includes standards for behaviour and conduct. What do we think? So it's something that's written down. It lays out expectations. It makes care safe, effective and compassionate. And it tells healthcare professionals how they should behave and conduct themselves. Does anyone know? Okay, Georgina's saying policies. Very close, Georgina, but not quite. Gabriella's saying policies as well. Okay, so this is a code of practice. So this is more general than a policy. So a policy is on a specific area. A code of practice covers everything. So it means that when a nurse or a midwife or a doctor is at work doing their daily practice, so their daily work, they have to follow this code, and it tells them how they should behave, that they should treat people fairly, compassionately and so on. Whereas a policy is about something specific, so a safeguarding policy or an infection control policy, and that tells you the specific steps you must follow to carry out that policy. Okay, another big reveal. So our first question, or clue, sorry, an organisation which regulates health and social care settings. So this is testing what we've done at the beginning of this live revision stream. Second clue, it makes a judgment on the overall effectiveness of the provider. So we're looking for a regulator of health and social care settings, which means services, so hospitals, residential care. It focuses mainly on services for under 18s. Okay, Georgia, is saying Ofsted. I think you could be onto something there, Georgia. The next clue includes residential care for children. And then the final one, and other settings where children live or receive personal care. Yep, Georgia, I think you're absolutely right. It is Ofsted. Well done. Let's give you a clap. Okay, so we need to remember that Ofsted, whilst it does inspect and regulate schools, in terms of health and social care, what we're thinking of is residential care settings for children. So settings where children live or receive personal care or care to support their activities of daily living. Okay, and another one now. So our first clue, responsible for monitoring and inspecting health and social care services, ensures high quality services which are safe and effective, monitors and inspects many services including care homes. So which organisation do we know that monitors and inspects care homes, making sure that they are safe and effective? So we know it's not Ofsted because we've had that one. Daniela saying NICE. NICE does not do any inspections, Daniela. What NICE does is establish treatment guidelines and best practice, but it doesn't inspect services, so they never go into a service and inspect what's happening. Okay, so Nevaeh is saying CQC. Daniela's corrected herself to CQC. Okay, let's have a look at our remaining clues. So services must be registered with this organisation and it provides standards which must be met by all. Yep, well done, both of you. Care Quality Commission, the CQC. Okay, we're now going to do a bubble quiz, which is slightly easier, I think. I'm going to give you a question and then a range of answers on the screen. There could be 0 correct answers, 1 correct, 2, 3, or all 4 could be correct. So what I want you to do is put the letters in the chat of the correct answers. So our first question is, which of these are promoted by regulation? Is it A, continuous improvement, B, public safety, C, the rights of service users, D, quality of care? So which of these is promoted by regulation? So if we regulate our services, do any of these things result or happen because of that regulation? What do you think? Okay, George is saying B and D. Daniela's saying D. Anyone else have any ideas? Nevaeh, what do you think? Nevaeh is saying B, C and D. So in this case, it's actually all of them. So because we regulate services, that means that they are expected to continuously improve. They don't just stay the same. They get feedback from inspections and regulation, and that helps them to improve. It keeps the public safe because we're ensuring that our services are safe and fit and right for the service users. We promote the rights of service users and we give good quality care. Okay, question 2. I talked about revalidation earlier. Remember, revalidation is proving that you can still be a midwife or a nurse. So which of these are required for a nurse to revalidate? Is it A, 5 pieces of practice feedback, B, 450 practice hours, C, a professional indemnity arrangement, and D, 35 hours of CPD? So if I just talk through those to help you. So 5 pieces of practice feedback, that can be pieces of feedback from a colleague, so another member of staff that you work with. It could be from your manager, or it could be from a family member or service user. So that's feedback on your practice, so on how well you're working as a nurse. 450 practice hours means 450 hours of working as a nurse. Professional indemnity arrangement means having insurance in place. If you work for the NHS, that is provided by the NHS. If you work privately, you have to purchase your own insurance policy. And then D, 35 hours of CPD. That means 35 hours of continuing professional development. So 35 hours of going on a course or reading journal articles and then writing a report on them and so on. So 35 hours of continuing education. Okay, Saifullah saying D. Sorry. Jessica is saying A, and Daniela A and B. Sorry about that. Okay, the correct answer is all of them. Well done, Georgia. Let's give you a round of applause. Okay, the next question. Which of these organisations regulate health and social care settings? So we've done this multiple times in this live stream. Is it A, Nursing and Midwifery Council, B, Ofsted, C, Health and Care Professions Council, D, CQC? Remember, health and social care settings, so services. We're talking about hospitals, talking about residential care homes, GP practices, dental practices. Which of those? Okay, we've got Jessica saying D, Nevaeh saying A, C and D, Georgia B and D, Zyphlon A. I can reveal that, Georgia, you are correct, B and D. So remember, Nursing and Midwifery Council regulate professionals, so nurses and midwives. Health and Care Professions Council regulates professionals such as occupational therapists. So they regulate professionals, whereas Ofsted and the CQC regulate settings or services. You need to be really clear on this for your Unit 2 exam. Okay, question 4. How can organisations respond to inspections positively? A, by creating an improvement plan using reports. B, by feeling angry. C, by ignoring inspection results. Or D, by providing updated staff training. So which of those do you think is the correct answer? A, B, C or D, or a combination? Okay, brilliant. Well done, Georgia and Nevaeh. A and D, you are correct. Give you a round of applause. Okay, so now we're going to do Mend the Gap. So I have a paragraph on the screen. I'm going to read it to you, and there are some missing words or phrases which are blanked out. Your job is to find out or work out what is behind those blanks. And it's about accountability. So accountability in health and social care refers to the obligation of individuals and organisations to be responsible for their something, starting with an A, and something, starting with a D. It ensures that everyone involved in providing care is held to high something, starting with an S, of practice, ethics and professionalism. Key aspects of accountability include something, starting with an R, transparency, compliance with standards, quality assurance, continuous something, starting with an I, and patient-centred care. So have a read through that again and see if you can work out what is in the missing gaps, okay? And you can look and see the first letter of each word is provided. So accountability in health and social care refers to the obligation of individuals and organisations to be responsible for their something and something. What do we think for that first one? Okay, I can see that Nevaeh is saying standards of practice, so that our third blank, second sentence, ensures that everyone involved in providing care is held to high standards of practice. Well done. Can anyone guess any of the others? What do we have to be responsible for? Okay, let's go through actions. Brilliant, Georgia. Well done. And actions and... Well done, Rebecca, as well. Brilliant. Okay, the first one, actions, and brilliant, Rebecca saying decisions. And then Nevaeh gave us standards. So we just need those last two then. Key aspects of accountability include something, transparency, compliance with standards, quality assurance, continuous something, and patient-centred care. What do we think those last two are? Let's reveal. So responsibility, transparency. Well done, Nevaeh. Yep. Well done, Rebecca. So the last one, continuous something beginning with an I. That one is continuous improvement and patient-centred care. Well done, Rebecca. Brilliant. Let's have an air horn for that one. That was a good collective teamwork there. So this is a really nice explanation of accountability and what accountability means, which is something that sometimes we struggle to articulate. So you can have a look at this again after the live stream, watch the replay or download the PowerPoint and make sure you're really familiar with this as a concept. Okay, I want you to think about ways that we can support and safeguard employees. So if you were a manager working in a health and social care setting, how could you support your employees and keep them safe from harm whilst they're at work? So any ideas that you have about this? So responsibilities of managers in safeguarding and supporting their employees. I'll give you a 30-second timer, so you've got plenty of time to type your answers. Okay, we've got some nice answers coming through from Nevaeh and Georgia and Jessica. Hi, Jessica. So we've got Nevaeh saying risk assessments and following legislation. Georgia is talking about confidentiality and policies. Jessica is also saying about following policies. Brilliant. Let's have a look at what I've got. So my answers are a little bit more specific than yours. So I have said that you need to have a robust external complaint and internal grievance systems. So that means that you need to have a complaints policy and a complaints process, so that if a member of the public or a service user wants to make a complaint, they have to follow the set policy and it will be investigated fairly. So that does safeguard your employees because it protects them from maybe complaints that are not warranted or don't have any evidence behind them. Then you also must have an internal grievance policy and procedure. So grievances are what you raise when you're unhappy with your workplace. So a complaint is for the service user, but the internal grievance system is for the member of staff. So if the member of staff has any issues with something in the workplace, they can use the grievance system to do that. And that supports that individual member of staff and safeguards them, because it means that, again, there is a system that they must follow, a procedure, which means that any issues or complaints they have are investigated fairly. We can also encourage staff members to be members of professional bodies like the Royal College of Midwives or the Royal College of Nurses, and also to join a union. So a union gives people collective bargaining power. So if you work as a nurse, you could be a member of the Royal College of Nurses, and if you have a grievance at work, you can ask for the trade union to support you and help you through that grievance. So they can sit with you in any meetings, they can help you respond to any written requests for information and so on. So you guys talked about policies, brilliant. So we have to have protective policies in place, for example, a lone worker policy. So if you have a member of staff that goes and works in individual people's homes, they are a lone worker, they're going there on their own. So you need to have a policy which keeps them protected. And that could include risk assessments, as Nevaeh has pointed out. We also need to have equality, diversity and inclusion policies to ensure that all people are treated fairly and free from discrimination, regardless of any protected characteristics. And then we also need to have a really robust whistleblowing policy and link procedures. So whistleblowing is what we do if we see any unethical practice, any unsafe practice, or neglect or abuse or harm, and it allows us to report that and be sure that something is going to be done about it. So well done, guys. Give you another clap. Okay, so that's the end of today's live stream on accountability, inspection and regulation. I do appreciate it's a tricky topic. Do download the PowerPoint. Give me about 20 minutes to upload it to the website. You can download this PowerPoint and go through it again. You can also watch the replay. If there's anything you're not sure of, you can ask your teachers and your lecturers at school and college. So I'll be back on Thursday for Unit 2 revision at, 6:30 p.m. So if you would like to join me then, that'd be great, and I'll see you then. Take care, guys. Bye.